Okay, we're going to review some of the anatomy of the pelvis on this CT of the abdomen and pelvis. Let's start with the osseous structures. So starting from the top, the first thing we have is the lumbar spine. So on this sagittal reformat, let's go to the bone window. We can see the lumbar spine, the 5 segments, and ending with L5, which is separated from the sacrum by an intervertebral disc. The sacrum usually has 5 segments, so S1, 2, 3, 4, and 5, followed by the coccyx. Now the coccyx has a variable number of segments, usually somewhere between 3 and 5, and can have a varied appearance, but here it seems like we have 1 segment, 2 segment, and then a rudimentary 3rd segment here, the coccyx. So let's look at that in the axial view. And if we go back up to L5, here's the L5 vertebral body, and as we go down, we're going to get into the disc, which is not as dense as the osseous structures, and so it's going to be a lower density. That then contacts the upper aspect of the sacrum, or the S1 vertebral body here. And we can see that the sacrum articulates bilaterally with the ilium, as far as with the sacroiliac joints here on the right and on the left. Now the ilium continues inferiorly down to the hip joint in the region of the acetabulum, and here it's joined with the pubis and the ischium. The pubis is going to be anteriorly and the ischium posteriorly. Now these are fused together, and so you can't really tell where one starts and one ends. But let's go anteriorly. So here's the pubis continuing anteriorly to articulate with the other side at the pubic symphysis. If we go back up to the hip joint, we have the ischium posteriorly. Here's the ischial tuberosity posteriorly, and the ischium then continues inferiorly and anteriorly to join the pubis along the inferior pubic ramus. Now to find the anterior superior iliac spine, I usually go from the top of the ilium, continuing inferiorly, and then usually the anteriormost point here that's very superficial and close to the skin is going to be the right there. That's the ASIS, the anterior superior iliac spine, which to it is going to have the tendon of the sartorius muscle attached to it, which is right here. Here's the sartorius muscle. Coming back up, it's going to be a tendon, and then it's going to insert right here on the ASIS. Next, we're going to look at the vascular structures. So let's do the soft tissue window, number 1. And let's start from the top, and we'll go from the abdominal aorta. Kind of the inferior aspect of the abdominal aorta is going to split into the right and left common iliac arteries. Let's follow it on the right side. Here's the right common iliac, continuing down a short segment when it splits into the right external and the right internal iliac arteries. Now the internal one is going to dive down and posteriorly into the pelvis, where it gives off multiple branches, which we're not going to name in this exercise. So let's go back up. Let's follow them back up to where it started. So right here is the common iliac, and then splitting into the internal, external, and the external is going to continue out and exit the pelvis through the underneath the inguinal ligament out into the thigh up here. And at the point where it exits the pelvis, underneath the inguinal ligament, is when it becomes the femoral artery. So it will be the femoral artery out here. For the veins, we can do the same thing, starting from the top. Of course, the veins are flowing the opposite direction. But here is the IVC, formed by, if we go inferiorly, the right and the left common iliac veins. So see, the left common iliac vein has to go underneath here in front of the vertebral body to join the right side and form the IVC. Again, here's the right one. The right one is formed by the internal and the external the internal and the external iliac veins. Again, the internal is formed by veins from deep down within the pelvis, while the external comes from the thigh, and it exits here with the right external iliac artery. So that's it for the vasculature.